patients, whatever they already have the client base, can make 1 lakh plus revenue easily from the day one. The main thing for a cosmetology clinic is all the lasers, RF machines, and all the Korean brands, a lot of fee. So that centrifuge machine will hardly cost you 10,000 rupees. So with that, people can start practicing the basic cosmetology.
Hi viewers, this is Dr. Prince. Welcome back to your channel Dental Treasures. In this episode, we'll delve into the topic of cosmetology and its significant impact in our dental industry. Join us as we embark to an exciting journey in the world of cosmetics and how you as a dental surgeon can discover its potential. I'm sure a lot of you have a lot of queries regarding the same. All your doubts will be cleared in this session. So we are talking about the cosmetics or cosmetology in general, not cosmetics in dental practice. So before we commence, please show your support by liking, sharing and subscribing to the channel. Today we have with us Dr. Venu Jairam and Dr. Akash, who's going to guide us through this topic. Dr. Akash CL has completed his fellowship in facial aesthetics and also holds a master's in hospital administration. He gained valuable experience as a medical officer in Banaswadi. Following that, he served as a nodal officer for the Zonal COVID Commander Center in Bangalore East for 2 years. Currently, Dr. Akash runs Sky Dental Clinic with branches in Koramangala and Hennur. He expanded his services by establishing Sky Med Spa in Koramangala. In addition to his dental practice, Dr. Akash is also associated with Sky Academy. In the previous episode, we discussed about the clinical aspect of cosmetology. In this episode, Dr. Akash will clear about the financial aspect of cosmetology. So, Dr. Akash, welcome to my show.
Thank you so much for making me part of your channel, and I'd be really loving to do this video with you. And I'll just give as much as information I have about this, and so that it'll help a lot of people.
So, doctor, can you give us a list of armamentarium required to practice cosmetology in dental clinic?
See, if I say a person can practice with worth of minimum 50,000 also, like there are so many treatments like GFC and PRP. The only investment they need is a centrifuge machine. So that centrifuge machine will hardly cost you 10,000 rupees. So with that, people can start practicing the basic cosmetology. And if you include all these lasers and everything, yeah, it is going on the expensive side. But the basic thing you require is a centrifuge, the chair, and all this doctor pen to practice all this micro needling and everything. And yeah, you're doing very good. And after that is, then you can go to the lasers. Okay, you can go for the diode lasers, pico lasers, and after that you can go for the hydrofacial machines, oxygen-facial machines. And even if you say that, there are a lot of brands in the market which were actually available. There's some Chinese brands, there's some FDA approved and everything. It depends on what type of clinic you want to set up and that type of machinery you can purchase. So, but the main thing for a cosmetology clinic is all the lasers, RF machines, and all the pens like Dharma pen and PMU pen for practicing, and cautery. These are the main things which you can start with.
So that costs approx how much?
Approximately, if you go with excluding lasers, it will only cost you like 1 lakh. Including lasers, it will cost you somewhere around 5-6 lakhs. Okay, and the main thing is cosmetology is not just machinery; it's more than that. You don't need so much machines also to practice cosmetology, like Botox, fillers. You just need a syringes and the material for that. So it's not just the machinery; it's totally a vast concept.
Talking about the fillers. So for each session, you might have to order fillers, right?
Yes.
So how much would that approximately cost?
See, the fillers, a lot of Indian brands, a lot of Korean brands, a lot of US brands. So I would suggest doctors here go with the Indian brands. That is starting somewhere around from 15,000 to 25,000 rupees for the basic thing. Like depends on the quantity you're using.
And for how many sessions can we use these?
We can use that for approximately, like if you're doing for the under eye fillers, you can use it for like 2-3 patients at once. Okay, so and depends on the brands again. There are a lot of brands, there are a lot of life. So anyone I would suggest, please go through the description on the brands or the material what you're purchasing and go with the pricing accordingly. Like there are some brands where you get the fillers for 90,000 rupees also. But if your patient is willing to pay so much, yeah, you can take it. It depends on how much your patient is willing to pay.
And what would be the average shelf life for these?
The fillers have a good shelf life of 2 to 3 years. So yes, okay. And other than fillers, Botox is somewhere around. We calculate Botox in the units. You know, what is the average price going on in the market is like somewhere 500 rupees. But you get the each unit, like one particular box will be having 100 units like that. Okay, each unit you'll get it somewhere around at the price of 200 to 300 rupees depending on the brand. So ultimately the thing is, you should take the product according to your practice. Yes.
So how can one procure these fillers?
So there are a lot of brands. There's a brand called Akar. There is, see, overall it's see the local dealers who are supplying there, and that they are guaranteeing that materials, and check if it is registered under Indian this drug licensing and everything will be there, that license numbers and all of that. Make sure of that, so that will not cause you any medical legal problems later. Like if you use any Korean brand because it is giving very, very good result, what if something goes wrong? No one is backing you because using some other product. Okay, so I would suggest there are a lot of brands in the market. Okay, so it depends on which brand is supplying in area. For example, the people who are supplying in Bangalore are not supplying in Mysore. So please look into that.
How much revenue can one generate by practicing cosmetology?
So it completely depends on what kind of practice are the doctors are into. For example, there are mass practices, there are like premium practices, what are going, and there are corporate practices. Okay, let's keep the corporate practices away, but we are concentrating on the doctors who are practicing singly. So mass practice, I would say there'll not be much change because they're always spending complete their time on dentistry. So I would suggest mass practitioners, if they're really practicing that, that will not add up that much revenue to them. But this practices where I like premium practices and the normal practices where they have like 2 to 3 walk-ins in a day, like approximately they'll have 60 walk-ins in a month. So that will help them a lot. For example, if you have 60 patients, okay, if you're able to convert 15%, like 3-4 patients to get the cosmetology treatment, you're making a good revenue of 1 lakh plus of what already is happening in your dental clinic. So if I can take an example, let's say the hair treatment. So there is a patient who walked in, they wanted to get the teeth scaling and everything. Yeah, it's done. So the doctor can just talk to the patient if he sees something like hair thinning or is seeing something like hair loss, to go with the basic GFC treatment, just in the centrifuge and GFC tubes. Okay, that will never cost a dentist like to procure it, not even 20,000 rupees. Okay, and the present rate, what is going in the market, the average rate for GFC is 6,500 rupees per session. Okay, so if they're even charging less than that also, one patient they're booking even minimum, it needs minimum 5 sessions for the result. Like one patient they're booking 5 sessions and the other patient they're doing some basic facial or something. Easily from 3-4 patients, whatever they already have the client base, can make 1 lakh plus revenue easily from the day one.
Only via cosmetology.
Only via cosmetology. That is the revenue that will add up to the already existing practice. If they're going too deep into it, if you're putting very good machineries, you can easily make 2 to 3 lakhs plus revenue in a clinic, which is in a very good place and which is having a good walk-ins. Yes. And even if they don't have the good walk-ins, they can start publicizing with the boards and everything. No, a lot of dentists, we know it that they are waiting in the clinic for the patient, and we can spend some extra time with that patient to help them to look beautiful. That's the overall point here. Because there's so much vacancy but no skilled people. So I would say there's a lot of opportunity everywhere, not just in the metropolis. People are spending more on their looks and hair and everything than health. Cosmetology clinic ROI starts after 3 to 4 months.